Hello guys, welcome back to my YouTube channel. From this video, I am going to discuss about the trigeminal nerve and related sensory pathway. So, you will learn about motor and sensory nuclei, trigeminal ganglion, intracranial cause of ophthalmic division, maxillary division as well as the mandibular division, and trigeminal sensory pathways, the corneal reflex, the role of mesencephalic nucleus, and finally the jaw reflex. So, the trigeminal nerve is the fifth cranial nerve and it is the largest cranial nerve. It has a large sensory root and small motor root. So, it is a mixed nerve. Its sensory ganglion is known as trigeminal or Gasserian ganglion. The branches of main subdivisions of the trigeminal nerve are related to four peripheral parasympathetic ganglions. Those peripheral parasympathetic ganglions are otic ganglion, then ciliary ganglion, submandibular ganglion, and spinopalatine ganglion. First, we will see about the motor and sensory nuclei of the trigeminal nerve. So, trigeminal nerve is related to one motor nucleus and three sensory nuclei in the brain stem. So, first I am going to discuss about the three sensory nuclei which is situated in the brain stem. So, you can see these are the three sensory nuclei. Here, the mesencephalic trigeminal nucleus and the main sensory nucleus of the trigeminal nerve and the spinal trigeminal nucleus. So, this is a long sensory nucleus which extends the entire length of the brainstem and it is divided into three parts, as I already told you. The principal or chief sensory nucleus is present in the pons lateral to the motor nucleus. This is the chief or the principal or the main sensory nucleus. The nucleus of spinal tract of trigeminal nerve begins in the principal nucleus and goes down beyond the lower end of the medulla oblongata, where it is continuous with the substantia gelatinosa of the second cervical segment of the spinal cord. Then you have the mesencephalic trigeminal nucleus, which lies in the midbrain, but it continues inferiorly with the principal nucleus of the trigeminal nerve. So, those are the three main sensory nuclei. Here you will see the motor nucleus which is located in the upper part of the pons. This is the trigeminal motor nucleus. When we talk about the functional importance of sensory nuclei, this mesencephalic nuclei is concerned with proprioception and it is equivalent to the sensory ganglion as it is contains the pseudo-unipolar neurons. The principal sensory nucleus receives discriminative touch fibers. Then the nucleus of a spinal tract is concerned with pain, temperature and light touch. Then this trigeminal nerve emerge from the ventrolateral aspect of the pons. This area is the pons at its junction with the middle cerebellar peduncle. The sensory root bears trigeminal ganglion. Actually, the sensory root and motor root both together emerge from this ventrolateral aspect of the pons. In this picture, I will show you the trigeminal ganglion. This is the trigeminal ganglion. This ganglion contains cell bodies of pseudo-unipolar neurons, that means first order neurons, and it is a semilunar in shape. Its anterolateral surface is convex. Anterolateral surface is convex and posteromedial surface is concave. The location of this trigeminal ganglion is, you can see, it is in the middle cranial fossa in contact with the anterior surface of the petrous part of the temporal bone near its apex. This area is the middle cranial fossa, this area is the anterior cranial fossa and this is the posterior cranial fossa. So, when we talk about the dural relations of the trigeminal ganglion, this trigeminal ganglion is housed in a pouch of dura mater called trigeminal or Meckel's cave. This dural pouch is formed by evagination of inner layer of the tentorium cerebelli. This is the tentorium cerebelli. You can see in this side, this is the tentorium cerebelli. So this trigeminal cave is, or this dural pouch is formed by evagination of inner layer of tentorium cerebelli. The sensory root of the trigeminal nerve emerge from the posteromedial concave surface, then the ophthalmic division, then maxillary division, and the mandibular division of the trigeminal nerve emerge from its anterolateral convex surface, and then they pierce the dura mater of the trigeminal cave. Imagine if there is a lesion in one side of the trigeminal, one side trigeminal ganglion, we call it as trigeminal neuralgia. That means it is characterized by paroxysms of acute pain in the sensory area of one of the divisions of the trigeminal nerve of the particular site. To stop the agonizing pain, sometimes the trigeminal ganglion is approached for injecting medicine via foramen ovale inside the infratemporal fossa. So that is called as trigeminal neuralgia. Then another condition, when there is a viral infection in the neurons of the trigeminal ganglion, actually it results in herpes zoster or shingles, in which there is eruption of painful blisters in cutaneous distribution of any one or more of the main divisions of the trigeminal nerve. So if the one of the divisions involved this affected by this herpes zoster or shingles, the particular area, one side particular area which is supplied by this particular subdivision, you can see the painful blisters. Here you can see very clearly, this is the trigeminal ganglion, and you can see the three main divisions coming from the trigeminal ganglion, and then here is the ophthalmic division. So when we talk about the intracranial causes of this ophthalmic division, maxillary division, and mandibular division, this ophthalmic division, it is purely a sensory nerve. It enters the lateral wall of the cavernous sinus, where it lies below the trochlear nerve, and it gives a recurrent tentorial branch for the supply of tentorium cerebelli. Then it divides into nasociliary, lacrimal, and frontal branches. This ophthalmic division further divides into three main branches. That means nasociliary, lacrimal, and frontal branches in the lateral wall of cavernous sinus. All these branches enter the orbit through the superior orbital fissure. Then this maxillary nerve. Maxillary division is a purely sensory nerve. It enters the lateral wall of the cavernous sinus, and it occupies the lowest position of the wall of the cavernous sinus. And it gives a meningeal branch to the dura mater of the middle cranial fossa and enters into the pterygopalatine fossa. In this area, pterygopalatine fossa, via the foramen rotundum. Then the intracranial cause of this mandibular nerve. This mandibular nerve is the largest of the three subdivisions. So it is a mixed nerve, which contains both sensory and motor fibers. The sensory root arises from the trigeminal ganglion, and the motor root originates from the motor nucleus in the pons and pass deep to the trigeminal ganglion to join the sensory root at or just below the foramen ovale to form a short trunk of the mandibular nerve. Then it leaves the cranium through foramen ovale to enter into the infratemporal fossa. I explained about this mandibular nerve, the further course of the mandibular nerve, in the video of infratemporal fossa. So you can watch watch that video. I'll put the link in the description box as well. Now we will see the branches of the 8 subdivisions briefly. So here from this picture you can see this is the trigeminal ganglion, which contains sensory roots, and you can see the motor root here, and this is the ophthalmic division. Then you have the maxillary division, then you have the mandibular division here. So you can see the ophthalmic division is divided into 3 branches as nasociliary, frontal, and lacrimal. So this frontal nerve supplies supraorbital and supratrochlear region, and this lacrimal nerve goes into the lacrimal gland, and you can see this nasociliary nerve here. Here the nasociliary nerve gives branches as the anterior ethmoidal. Anterior ethmoidal nerve supplies the nasal cavity and skin of the tip of the nose. Then the posterior ethmoidal nerve supplies ethmoidal and sphenoidal sinuses. Then infratrochlear nerve. It supplies the nose above the medial canthus of the eye, conjunctiva, upper eyelid, and lacrimal sac. Then there are long ciliary nerves which supplies the ciliary body, iris, and cornea. Here, I told you earlier as well, the frontal nerve divides into supraorbital and supratrochlear branches. This supratrochlear nerve supplies upper eyelid, conjunctiva, and forehead nearer the midline. Then the supraorbital nerve supplies upper eyelid, conjunctiva, forehead, scalp up to the vertex, and frontal sinus. So here, the yellow color area, you can see yellow color area, the sensory supply is given from this ophthalmic nerve. Then we will discuss about the maxillary division. So it gives meningeal branch. It supplies dura mater of the middle and anterior cranial fossa. Then it gives zygomatic branches which supplies the skin of the prominence of the face and temple area. Then superior alveolar branches which supplies to the teeth and upper teeth and gums. Then infraorbital nerve, it supplies lower eyelid and side of the nose and upper lip. Then palatine branches also there which supply to the mucosa of the palate. Nasopalatine branches supplies mucosa of the nasal cavity, palate, and maxillary sinus. Then pharyngeal branch is sensory to eustachian tube and mucosa of the nasopharynx. Orbital branches supplies the periosteum of the orbit, sphenoidal and ethmoidal sinuses. That's like a summary of branches of the maxillary nerve. Then you have the mandibular division. Here you can see here are the branches given from the mandibular division. The nervus spinosus supplies dura mater of the middle cranial fossa. This is the nervus spinosus. Then buccal nerve supplies the skin of the cheek and buccal mucosa internal to the buccinator muscle. Then auriculotemporal nerve. It supplies the auricle, external acoustic meatus, lateral aspect of the tympanic membrane and skin of the temple. Then lingual nerve is a sensory to mucosa of the anterior two-thirds of the dorsum of the tongue. This is the lingual nerve. And then inferior alveolar nerve. Inferior alveolar nerve is a sensory to lower part of the teeth and gums. Then mental branch of the inferior alveolar nerve supplies the skin of the lower lip and chin. This area is the sensory supply to this area is by maxillary division, and sensory supply to this area is by mandibular division. Remember that this area, the angle of mandible. Here is the angle of mandible, and lower part of the earlobe. It is supplied by C2. So from this diagram, you can summarize all the branches given from the each subdivisions of the trigeminal nerve. Now I'm going to discuss about how the trigeminal nerve testing, how the sensory areas of the subdivisions of the trigeminal nerve are tested. So this is a picture of jaw jerk, or how to do the jaw jerk. To elicit this reflex, the patient should open the mouth slightly, and then the patient should open the mouth slightly, and then examiner should place his index finger on the middle of the patient's chin and gently tap it. Here in this diagram, the afferent limb, this is the afferent limb, and it is the sensory component of the mandibular nerve which brings impulses of proprioception from muscles of mastication to the mesencephalic nucleus in the brainstem, and it is connected to the motor nucleus of the trigeminal nerve both sides. So from this reflex center is the motor nucleus of the trigeminal nerve. So from the motor nucleus, efferent fibers coming through the mandibular nerve, mandibular division of the trigeminal nerve. These are the efferent fibers. Hope you can understand clearly from this diagram how the jaw jerk occurs. This mesencephalic nucleus, when we talk about the role of mesencephalic nucleus, actually this mesencephalic nucleus is equivalent to the sensory ganglion as its neurons are pseudo-unipolar. And it receives proprioceptive fibers directly from the peripheral receptors. That means muscles, spindles, pressure and joint receptors, from the muscles of mastication, extraocular muscles, facial muscles, and temporomandibular joints. It projects to trigeminal motor nucleus of both sides. That is the role of mesencephalic nucleus. Remember that it receives proprioceptive fibers. Here I am going to explain about the trigeminal sensory pathways. The mandibular, maxillary and ophthalmic nerves carry sensations of touch, pain and temperature to trigeminal ganglion, and from the sensations are carried to the brain stem. Trigeminal sensory tracts pass through the three orders of neurons before reaching the face area of the post central gyrus. The sensory path begins in the first order neuron in the trigeminal ganglion. Then central processes of these neurons form the sensory root of the trigeminal nerve and enters into the pons. Then they terminate in the second order neurons in the sensory nuclei of the trigeminal nerve. The fibers that terminate the chief sensory nuclei convey discriminative touch and pressure sensations. The fibers that terminate the nucleus of the spinal tract conveys the sensations of pain and temperature. Then the second order neurons give rise to ascending trigeminal tracts. The axons of the neurons in the nucleus of spinal tract gradually cross to the opposite side and form ventral trigeminal tract. Hope you understood the trigeminal nerve pathway and its importance and how the nerve is tested, as well as what is the sensory pathway. So if you like this video, please put a comment and put a like and subscribe my channel for more further videos. Thank you for watching.